and welcome to this month's live. Just adjusting myself here inside Her Health Club. I'm Dr. Laura, and I hope you guys have been having an awesome month so far. August has been kind of a nice warm month here in Toronto, so most of us are trying to get out and about, and I just came from a walk outside, so enjoying a lot of fresh air as long as we have it, and the warm weather for that matter. So this month inside the club, we're talking about pregnancy. So if you guys have not yet fully looked at the content inside the membership site, I encourage you to do that. We go over each trimester, and last month's content was all about pre-pregnancy. So what to do pre-conception, and next month is going to be postnatal care. And I actually get a lot of one-on-one patients working with me on this because everything from weight to hair to energy. Of course, there's going to be a lot of normal changes that are going to happen postnatal, but there's a lot of things that we can also do to optimize that period. So the focus of this Her Health Club month content is, of course, maximizing the health of your pregnancy and, of course, of the baby. So we have a few questions here, and I'm going to kind of go through them one by one. And if you have any other questions or concerns, feel free to comment inside this group and post. So someone is saying, how do I take vitamin D if it makes me nauseous? I take 2 drops of the liquid and I want to throw up every time I do that. Okay, so nausea from general pregnancy is one thing, but if you're only finding the vitamin D, the liquid vitamin D drops, is causing you to be nauseous or vomit or just feel really sick to your stomach, then it might be the liquid source. So sometimes it's what we call the medium that the vitamin D is in. So it could be like a medium chain triglyceride. It could be an olive oil, basically the liquid base, the liquid carrier that the vitamin D is in. For some people, it just doesn't sit well, even if we're talking about a few drops. So if that's the case, I definitely recommend switching to a capsule or a liquid gel, so an actual capsule you can take. And they're pretty small for the vitamin Ds, and some of them even have more than 1,000 international units per little gel, so you could probably even just take one if you're doing 2 drops. And I recommend, of course, taking it with food if you're not already. So most women find they're most nauseous in the morning, and especially once their body has had a chance to sort of wake up and properly settle itself. But if you're not having morning sickness and it's just the vitamin D, then you definitely want to look at the form of vitamin D that you're taking, right? Is it in a liquid form? And if it is, like you said it was, then of course we might want to opt for another liquid, a different base, like a medium chain triglyceride, like I mentioned, or maybe you're taking it in a medium chain triglyceride, but maybe an olive oil would be better, or just switch to a gel cap. And those are really awesome and easy to take, and always with food for maximum absorption. Okay, can I do acupuncture for a breech baby? I've heard that might be helpful. Yes. So actually acupuncture, or what we call moxibustion, is actually like using heat in a certain area of the feet or of the foot, specifically near the baby toe. I know it sounds interesting, but moxa for short is a different type of treatment that could be paired up with acupuncture or instead of acupuncture or added to acupuncture. And this is most effective for turning a breech baby between 33 and 36 weeks. So you might find that if you've been told that that's a concern, the baby might switch on its own. Your OB or your midwife might have another manual technique to move the baby, but it's always ideal if we can get the little one to move on their own back into the optimal position for delivery. So the moxibustion is a great option, moxa as we call it, or acupuncture, and working with a naturopath or a licensed acupuncturist will definitely know what you're talking about. So if you just say that I'm having a breech baby and I want to make sure that we can try and optimize the position before birth, the optimal time is between week 33 and 36. Speaking of which, though, that reminds me of pre-labor acupuncture, which in general can help make labor shorter, less painful, ideally encouraging a vaginal birth instead of an emergency cesarean section. A lot of improvements to labor and delivery when we consider pre-birth acupuncture. And that's something that you would do with your naturopath or your acupuncturist every week, once a week from week 36 onward till you deliver. And you can start later if you don't get around to starting at week 36, but it's a really great time to prepare your body. And there's been a lot of studies actually on it. So just a sort of a caveat there. You can do acupuncture with breech to help turn that or increase your chances of the baby turning. But of course, pre-labor acupuncture has been studied, and that would be a regular occurrence after week 36. So I thought that would be useful. What safe exercises can I do in the third trimester? So for most women, right, it's only until their last month or so, their last 3 or 4 weeks, where their OB or their midwife, depending on the type of activity that they're doing, might say, hang on, refrain from doing the high intensity stuff or less of the jumping, or ideally no high impact work at that point. But some women have concerns earlier on, and their doctor or midwife has been telling them to stop that high intensity sooner. So it really depends on how fast the baby's growing, of course, how far along you are in your pregnancy. But if we're talking about third trimester in general, I mean, realistically, that could be, week 29, right? And for some women, that might look very different than week 36. So in terms of safe exercises, it's always whatever's safest is usually what you've been doing so far in your pregnancy. And then of course, unless you've been told to stop that because it's too high intensity, then you're fine to continue if you haven't been told otherwise. But in terms of adding an exercise at this point in third trimester, I always just tell women walking. If there's too much swelling or weight, the legs feel extra tired, I definitely recommend you might want to consider like a prenatal aquafit class. Water is so amazing for swelling and lower limb issues. So you might want to consider that in third trimester. Some of my patients do Pilates because remember, you're taking some of the pressure off the limbs, and we're doing only safe positions that would not put too much pressure on the abdomen. But basically, in short, exercise in third trimester is usually kind of a combination of what you've been doing so far in your pregnancy and then reducing the intensity during that last 4 weeks. So after week 36, you might want to be reducing that. But of course, your naturopath or your functional medicine doctor or your OBGYN will guide you through that, or midwife, I should say. Okay, speaking of swelling, I'm going to move on to the last question here, second last question. Swelling and lower limb swelling, or ankle swelling in this case. What can I do? Yeah, so swelling can be uncomfortable, especially in the warm summer months like we're dealing with right now. A lot of women find that uncomfortable, especially if they're working still, and it's hard on their feet, or they have to walk home or still do things around the house, especially if they already have another child. The swelling can be uncomfortable. There's actually a really great homeopathic remedy for this, and homeopathy is like a low dose, almost like an energy type medicine, very popular in Eastern Europe, very popular in parts of Asia. It's been around for ages, and it's safe. So you can pop into your local health food store or check online. The remedy is Natmur, Natmur, or Natrum muriaticum is the official name for it. But if you just Google in Natmur homeopathy, you would definitely be able to get some options on that. And I usually recommend women take their tiny little pellets. They're safe, and they can work wonders for swelling, because literally what it is low dose diluted salt. And salt and swelling help to rebalance the water content within the body, and that can be really helpful. Of course, always talk to your OB or your midwife or your naturopath before starting something if you have issues with high blood pressure or fluid balance within the body already. But I found that so helpful and so safe. Homeopathy is such an amazing remedy option for women because it's not going to interact with anything else. And then last but not least, birth plan. When do I make one? What is it exactly? Well, that's a great question. Your birth plan really is supposed to be something you can make as early as you'd like, but most people recommend the beginning of your third trimester. You really thought about writing things down, basically your plan for birth, for how you want the baby to be born, what you want the baby to be fed after birth. If you want to do the breastfeeding, you want to try to do that. Pain relief options, if you do want to go for an epidural, all those things. And your midwife and your OB should definitely encourage you to do a birth plan. So you might be early on in your pregnancy and that may not have come up yet, but that's definitely something that I encourage women to do, because third trimester is really, a lot of it is physical symptom for sure. But as we're getting closer and closer to the delivery date, it's a lot about hopefully good anxiety, but some, nervousness and excitement around the baby being born, and making sure everything goes according to plan is a very stressful thought for a lot of women. So understanding that you do have things in writing, that you've put thought into it when you're not at your, you're not in active contractions, and you've definitely given this the amount of thought that it deserves. And then, of course, having your doctors and your healthcare team know what's going on, so that if anything needs to change, you can be flexible. And I encourage women to be flexible. Like, if this can't occur, then this would be the second best option, and then not leaving yourself room for something to maybe shift a little bit, because life happens. So birth plan, third trimester, beginning of third trimester, ideally before then, if things, or you're very sure on how things are going. And like I said, it really depends on you and your pregnancy, but definitely the more detail you can put on there, great. And the more flexible you can be, if all of those circumstances don't work out, what is your next plan B option for, like I said, the pain options, the post-birth care, skin-to-skin contact, plus umbilical cord cutting, time after birth, those things which might be normal for you guys to hear, or maybe you're not, you're like, what are those things? Definitely talk to your OB or your midwife about a really good birth plan and what makes sense for you, and talk to your partner or anyone else that might be involved in making those decisions with you. Okay, so guys, we have talked about a lot of really great things this month inside the club. Each pregnancy is unique and individual, so I encourage you guys to really, look at the content, talk to your healthcare team about what those areas that might be affecting you now, or maybe you're thinking about, might be coming up soon, like trimester 2 or 3, and how you can best prepare yourself. So the information is meant to be used and shared, and really it's meant to help you make a decision that's right for you. And next month inside the club, like I said, we're going to be talking about postnatal care. So a lot of good stuff in that, and everyone needs to really tune in to that content, because there's going to be a lot of really good pieces of tangible advice and things you can start using, right away after baby is born. So, there's no reason why we can't optimize our health right after the birth, and, maximize your vitality as we're starting to heal and transition into this new chapter. So again, any questions, concerns, comments, guys, leave them in the video below. I know a lot of you guys do message one-on-one, and I'm okay with that, because I know it's a lot of a personal matter for some women, but I encourage, if you have a question, post it, because I know others might have and likely do have the same question. So we will see you guys in the next month's video.